Excellencies, ladies and gentlemen, good afternoon. I was delighted when I got to know about your event, which boldly emphasizes the importance of surgery as one of the key interventions to achieve universal health coverage. Universal health coverage is simply incomplete without access to surgery. And I'm referring here both to the geographic as well as the financial access aspects of universal health coverage. I say this with conviction, with concern, and with a lot of passion. Like most of you, I wear several hats. If I put on my NCD Commission co-chair hat on, I know well, as you do too, that surgery as an intervention has a significant role in the response to non-communicable diseases and injuries. One of my several other hats involves overseeing an access to surgery program called Heart File Financing in my country. On a daily basis, I hear stories from my teams and volunteers of osteoporotic elderly women with broken hips who would be taken away from the hospital bedridden and crippled for life if someone didn't pay for the needed nail to fix the joint. Over and over again, I hear heart-wrenching stories of families who become heavily indebted while paying for life-saving surgical procedures. Imagine a laborer with a broken leg waiting for a family member to sell a cow back in the village to pay for the operation, or parents who have decided to forego heart surgery of their child because they know how high the opportunity cost is and what a life of further impoverishment this will lead to. And it is not just the financial access aspect that is the problem. Across the continent of Africa and in many other countries of the world, individuals do not have geographic access to essential surgery. Those that can afford will travel overseas, but the poor will simply forego treatment, die prematurely, or live with the disfiguring consequences of disease. There can be nothing more dehumanizing than failure of systems to come to the assistance of people in such great distress. And it is critical that we pay attention to the huge unmet surgical need in the developing world. According to official statistics, as you know well, 5 billion people do not have access to safe, timely, and affordable surgical care. 9 out of 10 people in the low and middle income countries do not have access to surgical care when needed. And this may just be the tip of the iceberg. This is simply unacceptable. Let us recall that in 2015, the World Health Assembly Resolution 6815 was passed unanimously by the member states. The resolution called for strengthening of emergency and essential surgical care and anesthesia as an important component of universal health coverage. We must make sure that we pave the way for translating these commitments into action at this seminal meeting. I thank you for your attention.